done. कैसे होता है ये egg retrieval?
See, egg retrieval is a very simple procedure. I would say it is almost non-invasive sort of a thing because there are no stitches and there are no marks, there are no nothing on your tummy. What do we do is basically once the eggs are ready, we suck them out through a tubing, a very fine needle, and it is done through with the help of ultrasound as it is done transvaginally. All the patients who have undergone a follicular study or any ultrasound for gynae, this thing, they must have gotten an ultrasound which is done transvaginally. And in that case, ultrasound probe is used through which we can have a closer look of the uterus and ovaries via inside of the vagina. And through that, we suck out the eggs, and all those eggs are taken and used in making the embryos. So this way, if we say there is no mark, no stitches on the tummy of the lady. So in that way, it is a very simple procedure and it can be done under short GA. We don't need a complete anesthesia for this. And also there is no pain during the procedure. And it takes you 6 hours maybe. It is a daycare procedure. You get admitted in the morning, then you go back in the evening and you can resume your daily routine work from the next day onwards itself. So it is not that big a deal or big procedure kind of a thing. It is a very simple and short procedure which can be done almost non-invasively. It just requires 1 day hospitalization. That too only daycare.
Okay. Doctor, as we talked about egg retrieval, how it is done now, it's like what are the risks associated when you are doing egg retrieval? क्या risk associated होते हैं इसके साथ?
See, as such, obviously, if you talk about theoretically, definitely there are some risks which are associated with every procedure when we are giving anesthesia or we are doing something under ultrasound guidance also. But practically, if you'll ask me, there is hardly any risk. Less than, I would say, 0.01%, I would say, because we do it very carefully under the guidance of ultrasound. And we are just sucking out the eggs. We are not giving any incision, and we are not making any surgical mark or something. So I would say it is not a major. There are no major complications associated with this. And yeah, there is one thing which has to be understood, that is called OHSS. It is called ovarian hyperstimulation syndrome. That is a complication of the injections that we sometimes, when we give, sometimes some people, they can develop hyperstimulation syndrome. But even for that, nowadays, the protocol that we are following, the injections which we are using nowadays, there is hardly any case of OHSS nowadays. Earlier, there used to be, because there are many protocols which can be used for making eggs. So over the period of time, since the technology has been advanced so much, nowadays I would say there is hardly any case of OHSS if it is being done using the appropriate amount of dosage of the hormones, if the hormones are calculated nicely, and the protocol that we are using. So overall, if you will ask me, I would say there is hardly any complication.
Doctor, as we are talking about eggs and eggs retrieval, what are the methods involved during fertilizing eggs in IVF? क्या methods involved होते हैं?
Yeah, the methods involved, there are many. There are many advancement in the technologies that we are using nowadays. Earlier, the IVF that used to be done was the simple IVF, where we used to put in the egg inside a petri dish, and we used to just leave the sperms all around the egg. And in that case, the sperms used to fertilize the eggs on their own. But now, there are many other techniques that, like ICSI. ICSI means intracytoplasmic injection of the sperm. There we are taking one egg and we are injecting each egg with the sperm deliberately. And similarly, we have many other techniques like PIXI or MAX. All these techniques, they help us in selecting the best sperm first and then injecting or using that sperm for fertilization of the egg. This way, it ensures that the embryo that we are getting is of the best quality. And obviously then the potential and the potency of that embryo is good, so the chances of the successful positive result in that cycle are much more than if we are doing just the basic IVF.
Doctor, as we talk about fertilizing, so I would like to ask, what are the factors affecting a good number of eggs? क्या factors होते हैं जो eggs के good number को affect करते हैं?
So there are many factors. Actually, I would say most important is the age of the female partner, because the quality of the eggs, they decline really very rapidly, very steeply after the age of 35. So if the age of the female partner is less than 35, then definitely the quality is much better. Next is the dietary habits. If the woman is in the correct BMI, if she is not overweight or obese, and if she is having normal BMI, and she is having regular menstrual cycles, her hormone levels are normal, her thyroid levels are normal, and her lifestyle, her dietary habits, there is no history of smoking, no history of alcohol, then in such cases, the chances of having good quality of eggs are really very high. And this in turn definitely leads to A grade embryos, and that decides the successful cycle positive result in that particular cycle.
We are talking about eggs. What is a good number of eggs retrieved for IVF? क्या what quantity of good, what can we consider as a good number of eggs? क्या कर सकते हैं हम?
See, I would say basically we are transferring only 2 embryos in one transfer. Okay. But to make good quality A grade blastocyst embryos, we need at least, sometimes we say, okay, if we get maximum, I would say minimum 8 to 10 eggs. That is the minimum that we need, so that we can have good number of embryos to select from them and have the best embryos to be used for the transfer. Okay. But what do we usually happens is, on an average, we are able to get 15 to 20 number of eggs, because we try to make at least 6 to 8 number of embryos, so that if in case we have transferred to embryos and their cycle has failed, so that we will have some other embryos ready with us, and we don't have to go again with the whole cycle of stimulation and egg retrieval again, and we can plan another transfer using that embryos only. So that in that way, if we have 15 eggs, then that is a good number, because that gives us a good quality embryos, maybe up to 6 or 8. And this way, it gives us leverage of doing transfer at least thrice. This way, the chances of having a successful IVF cycle just after one stimulation will be approximately 80%, because we can go ahead with 3 embryo transfers. So this way, the overall costing of the cycle also is patient is able to afford it nicely, and because the success rate also improves so much.
If the quality of eggs is not good?
Yeah, see, what we try first, we try to anticipate. If we anticipate that the quality may not be good, in that case, we advise them to take some multivitamins, some antioxidants for maybe 2 to 3 months, and because all these multivitamins, they help in having good quality eggs. So first, if we are anticipating that the eggs are not going to be good, we ask them to make some changes in their lifestyle, make some dietary changes, add on some multivitamins and antioxidants. And then when we are going ahead with the stimulation protocol, we are adding on some other hormones, maybe growth hormone or something, so that we get the best quality of the eggs which is available at that particular moment. And once the eggs are out, we obviously grade them, we see. After that, we just try to make best quality embryos, whatever quality of eggs we have. So whatever has to be done, it has to be done prior to retrieval of the eggs. Nothing can be done after the retrieval. If after retrieval the quality of eggs is not good, then we can just try and make the best embryos, whatever is possible. So I always ask any patient who is planning to go ahead with an IVF cycle, they should start planning maybe 1 or 2 months or 3 months prior to that. They should make changes in their diets. They should make changes in their lifestyle. They should add on some multivitamins. We have some molecules which are particularly specific for the quality of the eggs. Those multivitamins, those molecules have been proven in studies that they improve the quality and the quantity of the eggs also. So there are some things, these are the things, but all of them have to be done before the retrieval of the eggs.